Hi, welcome to Case of the Day, and this is Tuesday, so we have one more case, which is the 107th, and this is titled Scaphoid Fracture, UTE MRI, and CT like bone images. So, this 19-year-old had a wrist injury during an MMA practice session in March. If you don't know what MMA is, look it up. Um, so no X-rays, has pain in the wrist and came for an MR, and you can clearly see there's a scaphoid fracture with cystic change, with marrow edema and contusion, with periosseous edema. And since now this is almost 6 months old, this would qualify as a non-union, and probably this cystic change is also responsible for, or maybe the result of the non-union. That's the sagittal image showing the cystic change. The axial T1 axis shows the fracture. We use a 3D proton density sequence which also shows what looks like a little fragmentation of the proximal pole, and there's edema, little sclerosis. Everything else seems okay. So we did a ultra short sequence, which is a composite, and this image is a composite of two separate images with two separate echo times of 1.6 and 3.5 milliseconds. The TR is 11 milliseconds, an isotropic 1 millimeter section. The whole sequence taking about 2.5 odd minutes. And then you invert this, so you make it look like a bone image. So just invert the window levels, and you can see here this fragmentation of the proximal pole, which wasn't appreciated on the routine MRs well at all. And then because it's reasonably isotropic, you can get your axial and sagittal images that also show the fracture pattern really well. And you can play around. So these are mean reconstructions which look like now X-ray like images, and you can see the scaphoid fracture very well. So one of the first major papers that came out was the radiographics paper that just showed examples of different bones in the body where the authors had used predominantly zero echo time but also ultra short echo time, or UTE. And I remember a couple of years ago we had this, or maybe last year we had this patient, non-displaced greater tuberosity fracture, beautifully visualized on the UTE image. So you get CT like bone images. And then earlier this year, Amit and Pranjal published this paper in radiology. Big deal, right? Getting published in radiology. And they showed this Olliers case, which was beautifully seen on this UTE image. And I had a talk in IMSOS in March earlier this year where I had to talk about recent advances, and I included that paper. And I had one case of an ABC, and there seems to be a fracture on the X-ray. The MR shows classic fluid levels. You can see the dynamic contrast, typical enhancement, but the UTE MR, the CT like bone image shows this fracture beautifully, and I thought that kind of showed why these kind of images are so useful. And at that time, about 6 months ago, I said this is what I said: CT like bone images. And especially when CT cannot be done at the same time, there are still some technical issues to be sorted out, and one additional MR sequence. Just last week, Amit and Pranjal published a review article in JMRI, and this is open access, so please go and look at it. It just looks at the physics, different sequences, applications, really nice images, and it is a very nice paper. So hats off to Pranjal and Amit for a lovely paper and for getting it published into JMRI. And it basically shows that UTE and ZTE they're here to stay now, and these sequences allow us to obtain isotropic thin section, CT-like bone images that give added information in select situations. I typically use it with occult fractures and wherever we need additional information, especially if we're not able to get a CT done. And I think more and more now, I've been using it very sparingly, but I think I'm going to use it much more often now. Or maybe just use it in a whole bunch of patients and see where it really helps in practice. Yeah. Let me know if you're using it, and get back to me in the comments. That's the panel in 2 weeks, my WhatsApp channel. Thank you so much for viewing this.